Speaking about appendicitis, what are the symptoms of appendicitis? How fast should one act? And how do we go about it? How long is the procedure? What are the complications if we ignore it, if we go to some quack and he delays it or just gives some painkiller?
Appendicitis simply means the inflammation or the infection of the appendix.
Okay.
It is just a worm-like structure, a tubular structure, which is present at the junction where the small and large intestine meets. Usually people experience pain around the belly button initially.
Yeah.
Then it shifts from here and it gets localized into the right lower abdomen.
Okay.
And it gets aggravated by walking, by coughing, by turning around. Sometimes the other symptoms one can have is the nausea and vomiting, anorexia, which means loss of appetite, and at times fever. Fever, we guess then it is maybe early perforation or perforated appendix.
Right. So when we speak about appendix, there were a lot of signs that we used to look for as a doctor: rebound tenderness, and that What are those signs? Can you mention a few so that people know if that a doctor is examining you right, and the investigations you need to go through?
So if a patient is coming with suspicion of appendicitis, I will ask patient to locate with your index finger if you are having any pain anywhere. Usually he points in this here in the right lower abdomen, McBurney's point. This is cough sign positive.
Okay.
Pressing this right lower abdomen, then we'll be having guarding over here.
Okay.
The muscles get stiff. Patient experiences pain.
Right.
Okay. And when we release the pressure, again he or she is having pain. That is called rebound tenderness.
Right. And what are the investigations you need to do? Just clinical, or do we need any other?
To diagnose the appendicitis is a diagnostic dilemma.
Right.
No investigation is 100% to exclude that this is not appendicitis. If some investigation, which is gold standard nowadays, is CT scan abdomen with IV contrast. But usually we go for the routine blood chemistry like blood CP, then urinary, and then we go for the ultrasound abdomen and pelvis, especially in case of females. Those investigations are not actually meant to diagnose the appendicitis, but to rule out the other pathologies that can present in a similar fashion.
Okay. So now appendicectomy is also available laparoscopically, so we don't have to do all those big incisions that we learned.
Only 3 small holes,
and that's
it. After 3 months, he or she has to tell that somebody operated on me for the appendicitis.
Okay, very nice.